You're watching TVC Breakfast. Now, the tagline for this year's commemoration of World Health Day is support nurses and midwives. It is a day to celebrate them and remind the world leaders of the critical role this health personnel play in keeping the world healthy, especially at this time when the world is battling the novel coronavirus pandemic. Now, health workers are on the front line, battling to save lives, and many of them have lost their lives in the process. Joining me now via Skype is the Director of Family Health at Lead Nurse African International Foundation, Julie Mobu. Julie, good morning. It's good to have you join me right now, and happy World Health Day. All right. Now, I was speaking with Dr. Ekanem earlier, and I was saying, what a time to really commemorate World Health Day when the world is really going through one of the toughest times when it comes to health. Now, talk to us. From the United States to London to Europe to China to Africa, everyone is saying thank you to all health workers working in the front line. But is that really enough? Because this has drawn our attention closer to what we have been discussing. Even you, we've had you on the show so many times, all the things we've been talking about all the while, how critical, how pivotal your role is in the society. Talk to us about this.
Interestingly, thank you so much for having me. Interestingly, yesterday, I made a post on social media and I said that this is one day that the world will remember. If there is any day to celebrate World Health Day, it is now. It is today, considering what the world is going through as regards the pandemic. Yes, all over the world, we have been making emphasis about the need to make significant contributions and investments in our healthcare system. There is a need to strengthen the healthcare system in so many capacities. But unfortunately, and we are experiencing it now in Nigeria, we haven't done much. We haven't even done anything at all, if I may say. The reason being that if you ask the average Nigerian out there who wants to have a baby, and then you tell them, why not go to one of the tertiary institutions or one of the primary healthcare centers to register where you can have your baby? And they say, oh no, I don't want that. So there's this lack of trust in the services that they will get from these public facilities. And I'm yet to see the synergy. I'm yet to see the collaborative effort between the public sector and the private sector. The fights that we are experiencing now against the pandemic, there have been much emphasis about the public sector. How about the private? They have contributions to make. People cannot go to the public facilities to access care. What will happen? Do they have the money to approach the private facilities to get their health needs met? So at this time, I think we have been called and forced to wake up to the reality that we cannot treat healthcare system as a trivial matter. It is integral, it is important, it is something that we need to pay attention to, give it all our best, because now it has been said that healthcare is very important. The world is at standstill because health is at risk.
Exactly. In fact, if the world didn't see it before, I guess they will see it now as it is. Now, talk to us basically. What is that ideal health sector that we are looking forward to, that everyone quotes, everyone talks about? What is that benchmark, real ideal healthcare system that we are looking for?
We're talking of a healthcare system that is easily accessible. When we talk about being easily accessible, we are talking about not having to travel too far to be able to access healthcare. So you should be able to take a walk and walk for about 10 minutes and be able to access healthcare. We're talking about affordability. Every citizen of a country should be able to afford basic healthcare services. Their children should be able to take, thank God, yes, that the immunization for the children are being subsidized. So people are being advised to have their children immunized. So we need to have more of that. And people should be able to access other kinds of healthcare needs other than immunization for the children. That's affordability. We aren't seeing this yet. And when we step into the healthcare facility, we should be able to be treated as humans. Now, I have this ideology that every patient, not just me, every patient belongs to a family, plays a particular role. So, upon getting into the healthcare facility, the business of those within that setting should be that let's get you well and back into the society to keep performing the roles that you were performing before. But we don't get to see that. We need to step up our game such that when people come into a facility, they are not mandated to drop some money before they are attended to. Yes, there's been some laws to say that when there's a case of emergency, at least for the first 24, 48 hours, a patient, especially when wheeled in as an emergency case, should be attended to either without a police report or without a police report, this person should be attended to at least for the first 24 to 48 hours. But what is the monitoring in place? Are hospitals exercising this? Are people, we still have complaints here and there about the kind of services, the quality, the kind of services that patients really get when they get to the hospital. So it's important for us to have equipment in place. It still baffles me that there are certain healthcare settings that still share oxygen machine or apparatus. Every ward is supposed to have, every bedside, there's supposed to be a central system supplying oxygen in case a patient needs it. How many patients have we lost because there is no immediate supply of oxygen? These are some of the things we need to look up. As small as the blood pressure monitor equipment is, some facilities still share. It is that bad. Every word is supposed to have, every facility, every, yes, there's supposed to be enough to go around just in case there's an emergency and you don't have to start looking for where to borrow from. Then let's go also to the part of training. How quality of the training that our healthcare practitioners are receiving. Trainings across board, training on clinical competence, training on soft skills, training on how to manage facilities. If you do not have the managerial skills, go get them. Don't just pick somebody because the person has some qualification to manage a facility. Is the person actually qualified to manage the facility? Does they have the necessary skills to manage the healthcare team? These are some of the things we need to be looking for. Is not to place a round peg in a square hole, but what is suited for a particular setting is what we should apply. So there's a lot that is demanded when it comes to the ideal healthcare setting.
Wow. All right. Julie, thank you so much for letting us know what we need to have as a good health system. And thanks for what you do, certainly. The world really appreciates what you do for them, not just here in Nigeria, but across the world. Thank you very much, Julie Mobile, for talking to us on TVC Breakfast. All right, now the tagline for this year's commemoration of World Health Day is Support Nurses and Midwives. It is a day to celebrate them and remind the world leaders of the critical role this health personnel play in keeping the world healthy, especially at this time when the world is battling the coronavirus pandemic. Health workers are on the front line, battling to save lives, and many of them have lost their lives in the process. Joining me now via Skype is the Director of Family Health at Lead Nurse Africa International Foundation, Julie Mobile. Julie, it's good to have you join me right now. Great.
Yeah.
Now, when it comes to supporting nurses and supporting midwives and supporting health workers, the rest of us who are not, although I am proud to have a mother who is a nurse, but how do we support you? How do we support the rest of us, the world? How do we support you in what you do?
All right, thank you very much. And it's good to know that your mom is a nurse. So the support we're asking for, first of all, is to accept nurses as a professionals who are competent enough to practice independently and also be a part of the interdisciplinary team. Now, that is a huge problem. It's as if nurses aren't seen as professionals. We hear comments from other healthcare workers who downplay the responsibilities and the functions of nurses. So it is important that nurses are first of all recognized as professionals who are competent enough to practice independently. That is one. The support we're also asking for is that we recognize the different and diverse specialties of nurses. Some of us may not know. We are still struggling with accepting general nurses. How much more the specialties? So we have up to 100 specialties in nursing. And then we have about 20 that are being taught at institutions. So that also has to be recognized, accepted, and deployed. We are also asking for support in the terms of training and education. Our educational institutions, we need to proliferate them, we need to upgrade them, we need to encourage nurses to take up nursing as a profession. Another way we can be supported is, yes, everyone is talking about salaries. There has to be some mouth-watering remuneration. Now, nurses are poorly paid compared to nurses in other climes. So there's a need, and that is one of the reasons we find many nurses leaving Nigeria to other countries. So there's a need for our salaries to be commensurate with the bills that we pay and the values that we bring to the care table. These are just a few areas. And then getting the nurses to work, employ them. We when I heard that the government was bringing in Chinese medical team or doctors to come into the country, and I went like, really? Are we done utilizing the skills that we have in Nigeria? We have many nurses that are roaming the streets and do not have jobs. At some point, the World Health Organization had introduced a model known as tax shifting and tax sharing. How well have we utilized that model? In other climes, there have been reasons for nurses to be trained
Yes.
to conduct surgeries and all that. What are we doing?
Yeah, but
How well have we?
Yeah, Julie, the point is, we all have heard how some medical practitioners, doctors, nurses, and the likes have traveled abroad, have left for greener pastures, and all of that. In fact, there was a statement that the Minister of Labour made at the time when he was confronted with the issue of doctors leaving the country. As a medical doctor himself, Dr. Christian Gige, he said, no, don't worry, we have enough doctors and nurses in the country. And there was a backlash against him for making that statement. So is there anything wrong in Chinese doctors coming to assist in what we have here?
Now, if we look at the form of assistance, there's nothing wrong in rendering assistance. There's nothing wrong in soliciting assistance. I don't have a problem with that. But is it the right time to bring them in? Have we exhausted all the resources that we have yet? Have we gone to the end of the road and we see that, oh, at this point in time, we are at our wits' end, there's absolutely nothing we can do, and we need external help? Let us ask them, what do we need? What are they coming to do to start with? Don't we have specialties? What is the challenge that is causing them to bring in? There's nothing wrong with getting assistance, but is it the right time to get this assistance? Before we know it, they're going to bring up one budget. Yes, this was the budget that was spent in either taking care of them or whatever. Some budget might come up somewhere in the future following this visit. That budget should be translated into something else. We're dealing with two pandemics here. We have the COVID-19 and then we have poverty. We have daily calls from people. People are not, why are they not staying home? Why are they not adhering to the restrictions? It's because they need to earn their daily bread. So that whatever money, even if it is 1,000 naira that will be spent on this Chinese doctor's visit, please, that money should be channeled into something else. When we've exhausted our resources, then we can call in for external help.
Now, the president at the time said that that the government was committed to building 10,000 primary health care across the country. I wonder how that is going, but what impact would that have in bolstering or supporting the healthcare system that we are all yearning for?
Yes, we appreciate the fact that plans like that are being made. I really do not know how that is going. Last year in January, there was an island that we visited, and they said they have not seen, they don't even have professionals there. There's a particular woman who said she was divinely assigned to be handling the deliveries. Of course, the people in that community have to make use of her services. And she rallied the children that she birthed, about 15 of them. Some of them were not around. And she's been doing that for over 15 years without professional help. I do not know where these centers are located. It's a good thing. I pray it's done. And if it is done, it will help the people. The idea of the primary health care is to ensure that people are able to access help. You don't need to travel, like I said earlier. You don't need to walk, you have to travel far before you can access this. Now, setting up those centers is one thing. Equipping the centers is another. Get the necessary equipment and get these facilities up and running. Then employ the professional hands. There are many nurses are overwhelmed. They have responsibility. The ideal ratio of a nurse to a patient is 1 to 4 patients or 1 to 6 patients, depending on the case they are managing. But what do we have in our institutions today? A nurse is managing 18 patients, 30 patients, and that is not the ideal. So you set up the centers, equip the centers, and employ professional hands to manage these centers. It's a good thing. And another thing there is that there has to be public awareness. If the public begin to see that these things are being done, if they are able to see the progress the government is making, evident progress the government is making, it will inspire trust in the people to access these services. Many people would rather self-medicate. Many people would rather seek insights from their grandparents or so. Even in this pandemic, we've heard about our grandfathers that are bringing up herbs and all sort of things to be able to uh, curb this virus. We need to let the people have trust in us. That's when I say us, the professionals, the government, that we have their health interests at heart and that we are doing all that we can to ensure that their health needs are met.
All right. Julie Mobile, thank you so much for talking to us on TVC Breakfast, and thank you for what you do. Thank you. For this year's commemoration of World Health Day, support nurses and midwives. It is a day to celebrate them and remind world leaders of the critical role this health personnel play in keeping the world healthy, especially at this time when the world is battling the coronavirus pandemic. Health workers are on the front line, battling to save lives, and many of them have lost their lives in the process. Joining me now on Skype is the Director of Health Family Health at Lead Nurse Africa International Foundation, Julie Mobile. Julie, we're glad to have you join us right now. You're welcome. Now, when it comes to the Abuja Declaration of 2015, where it was recommended that 15% of annual budgets for African countries should be dedicated to health. Now, Nigeria hosted that conference and was signatory to that agreement. But how much of that, talk to us from your perspective and what you have been seeing, how much of that is going into the health sector right now?
I don't think there is much that we can see following that declaration. Otherwise, we would not have much of these complaints from health workers. We would not see the deplorable state in which our health facilities are in. We will not hear perhaps that there are no monies to pay for nursing trainings and all that. So it's a challenge. Nurses are supposed to be engaging in research, but I have heard it's difficult for them to access funds to fund this research. So a lot still needs to be done. I mean, COVID-19 has opened it up all up for us. If we had that budget, if we have been implementing and executing as we should, we shouldn't be struggling to fight this pandemic. We should have everything in place.
All right. Now, the COVID-19 is here. Everyone is talking about it. Across the world, our hearts go out to a lot of medical personnel who were on the front line, who lost their lives. Back here in Nigeria, we also appreciate the level of pressure that this puts on all medical personnel. However, not all nurses and doctors are directly working in the isolation center. But for those of you who have been monitoring things, I don't know how you're working with them or indirectly or directly, but talk to us about what your day like is in this space of COVID-19. Share with us your experience.
Honestly, my day, I was just telling someone a few minutes ago, I said I am busier even in this lockdown than before the lockdown. And that is because we're receiving calls from nurses day in, day out. We are attending trainings with the World Health Organization and some other health related organizations on training on how to make use of the limited resources that we have to combat this. And we're trying to mobilize nurses. For instance, what we are doing on a daily basis is to monitor, call for, mobilize volunteers, put them into locations, group them into locations to see how we can take healthcare to people in their homes. Babies won't stop coming because there's COVID-19. People won't stop falling ill because we have a pandemic to deal with. There are people that have been suffering chronic illnesses. There are some that are on medications daily. They're probably supposed to be taking injections on a daily basis or as prescribed. How will these people access care? We have fear to deal with. People would not want to go to healthcare facilities to access care. Just yesterday, my neighbor asked us, I saw him yesterday and I asked him, where are you going to? He said he was going to the hospital. What happened? He developed a problem in his ears and he was concerned because that's an orifice to his internal system and he had to have it checked. I had to tell him, I said, okay, well and good. If you need to have a continuity of care, inform your physician that you have a registered nurse as a neighbor. So whatever care you have to undertake, you don't have to get back to the hospital. It's something that I should be able to handle, except perhaps he has to do a scan or something. So now we are mobilizing nurses across the country. We are grouping them into locations. We have developed an app that will help us trace where we have problems. And the challenge we're having is connecting to the NCDC or to the different commissioners of health to see how we can work together because all hands must be on deck. Not everybody is there at the clinical setting. Those that are at the front line, they don't have time to think about family, but they're going to be worried about it. We have the pressures coming, they are disturbed. Some of them are desirous, they want to resign. In short, I have nurses who have resigned from their jobs because they say, we are not prepared for this. I have a family to go back to. We have those that are worried sick. If I want to leave, but if I leave, will I have my job back? So these are some of the worries. Now we are looking at a way of designing programs that would help keep the nurses and other healthcare practitioners in a motivated state so that they can care for these patients.
So beyond the regular work of working, going to the hospital, now you have the responsibility of taking care of people who live around your neighborhood now because of the lockdown. Now,
Yes.
let's talk about the issue of lessons we have to learn from here right now. I was discussing with an analyst earlier on, and he's saying that a lot of Nigerians now have this feeling that what they couldn't solve before, they are looking forward to COVID-19 to solve by default. When it comes to the realities of our health system, everyone who found it very easy to travel abroad before can't go anywhere anymore. And now they are faced with the reality of patronizing one of the hospitals back home here. What lessons do we have to learn that we feel things we can correct going forward after COVID-19?
Okay, we could look at it at different dimensions. Let's start with the physical. Initially, some people would rather have their phones, their technology, and maybe not interact with their fellow humans. But now, COVID-19 has given us the opportunity to look at our spouses, look at our children in a totally different light. You don't know how long you're going to be on lockdown for, so you better just make that relationship a pleasurable one. So it's giving people the opportunity to identify what their weakness is and work it out and live together as a family. Now, financially, what we're saying to learn is people pick up businesses, but how sustainable are these businesses? If there happens to be a challenge, like entrepreneurs are looking at the choices of business and they are saying that healthcare is moving, food business is moving, agriculture, these are the people that constitute essential workers. And then the financial institutions, they're still working. So people are having a cause to rethink, am I actually in the right business? What if there's a total lockdown like this? Is my business going to continue to move? So these are some of the things. And then when we look at healthcare, we have seen that people can't travel. And I think many Nigerians are really happy that the wealthy can't just travel anymore. They're going to look inward. When this COVID-19 is giving us the opportunity to discover the talent, the resources that we have in our society on the Nigerian soil. They will begin to see the competencies that they have not looked into before. So many people didn't know, for instance, that there's something called home care nursing. People don't know that you have family nurses. People aren't aware that nurses can go beyond just giving or administering drugs, and they can do a whole lot more. So this is opening up our eyes to, okay, can we invest in this? If we can't have people trooping to the hospital, we are seeing COVID-19 is giving us the opportunity to learn how we can cut down on hospital queues. Because if you go to the average hospital, 5 a.m., people don't, it's like they sleep at the hospitals because they are queuing up to see the medical doctors. This is giving us an opportunity to share some of the task of some healthcare professionals and shift it to other healthcare professionals so that we can serve the dynamic needs of the people. The opportunities, the lessons are numerous to
All right.
learn.
Thank you so much, Julie Mobile, for all your analysis in this area. And I'm hoping that somehow we get to learn to correct all of these things that we complain about. Thank you so much for your time on the program.